All right. Hi, everyone. Welcome back to the Doctoring Duo podcast. It's been a few months of a hiatus, so we're really excited to be back. We're back fresh from taking step one. So that's going to be the topic of our video today, kind of talking about how we prep for step one, our advice, and kind of, any misconceptions that we ran into while studying for the test. And I think we're both okay with sharing this. We do both pass step one, so we do want to get our credentials out of the way. So that being said, let's go through our introductions. My name's Eleni. I'm a third year now, and that's scary. Medical student here at Penn State College of Medicine. As a reminder, I speak only for myself and not for my institution.
Yeah, hey guys, Noah, second, about to be third year, but technically third years because we're clinicals at Mayo Clinic Alec School of Medicine, newly located to Jacksonville, Florida, at our Florida campus. Happy to be here, just like Eleni. I only speak for myself and not my institution.
Oh man, step one.
Step one, what a beast of an exam. Well, I guess we should start out by, kind of like before we got into our prep, like what upperclassmen were saying, like what everybody on Reddit, like what were sort of your feelings before you started sort of going into step one prep?
I think for me, I really felt like I knew it was going to be a hard test, right? And I think that there's kind of two brands of people with step one, which is the first camp being it's pass fail, I'll be fine, and the second camp saying, even if it's pass fail, you better study your butt off. And I think I kind of fell in that latter camp just because I had actually gone through a passing U world before even starting dedicated, and like my average was terrible. Like those questions were hard. So I had a pretty healthy fear of the exam, even though it was pass fail. And that was kind of my approach to it. How about you?
Yeah, I would say just a combination of what we've read and like of course we're now only the second cohort that's taking it pass fail. Um so I definitely like you fell into the ladder of let me still prepare for it like it's scored. Um I think one of the things that was different between us as far as leading up to our prep is that I actually had not done a first pass EU world. I had used it a little bit during the latter part of my organ block systems. But what was different, also not only that, was that my school had MBME exams and you guys did not. So I wonder how it was interesting shifting from more of a short answer based format, whereas I've been used to and like sort of like pre-programmed to do well with that multiple choice, just kind of being reinforced by that through every single course that I took. I had a multiple choice exam and you guys for the most part did not, to my understanding. So how was it kind of shifting? Do you feel like you had a better knowledge going in because you truly had to understand it and not just guess on a multiple exam, or was it just such a shock for it to be a multiple choice?
So actually, Penn State has shifted to majority multiple choice on their exams. We still have free answer, free response. Excuse me. About 25% of our questions on our exams were that, I would say. So I think I was ready. I wasn't like phased by the multiple choice format, but what I was phased by was breadth and depth. And I think that the only time I'd ever encountered needing that level of breadth and depth was for MSK, like musculoskeletal anatomy, where you not only had to understand all the names of the bones, but also the muscles and nerves and their functions, right? So that was breadth and that was depth. And I think, especially, and I don't know, correct me if you feel differently, but I think, especially when you're in a pass fail type of school, you don't always go for that depth when you're studying, right? When you're kind of, you can cut corners on some things, or you can understand just enough of a topic to hit that 70% mark and say, okay, I've passed this exam. And I think that was the biggest shock for me, but I don't think that was necessarily a phenomenon just isolated to my school. I think that's for a lot of people who are pass fail. How did you feel?
Yeah, I agree. I guess sort of like that shift in mentality. I know, of course, the exam is still pass fail, but yeah, I think you're right. I think going through certainly preclinical courses and like the organ systems and your basic sciences, you can really get by a lot more on buzzwords and certainly on how the MBME exams are designed and knowing just enough to be able to recognize, oh, this is an aortic dissection versus an MI necessarily. I think the biggest shock for me doing New World and then later on, and we'll certainly talk about our prep with the official MBME exams, was that they're writing the questions nowadays where you really can't get by on a lot of buzzwords. You really kind of have to read the whole stem, and it's really testing your clinical reasoning and your diagnostic ability versus most of the time through the course, it's enough to be able to recognize and move on. But they're really starting to lean more to those second and third order questions where you're like, man, I know the diagnosis. I know this is a UTI. Now they're asking, what's the bug? Or maybe even like a tertiary question is they don't even tell you the bug. What's the antibiotic that you would use to treat it? So I think it really forces you to have a much deeper understanding of medicine going into your clinical rotations.
Yeah, I think that segues as well into kind of talking about our prep. But yeah, I think the biggest, I think even comparing the actual exam versus UWorld, I felt that UWorld kind of fed you some buzzwords, whereas the actual exam didn't necessarily do that. And I think that a lot of the actual exam was ruling out rather than ruling in. Because I found myself oftentimes putting answers to questions that I wouldn't necessarily pick first or wouldn't have been the most comfortable with, but my first choice answer was not there. And so I had to be like, well, this is technically not incorrect like every other answer around it. And so I think being able to kind of flip your mentality that way is one of the biggest challenges of step one.
Yeah, I would agree. And I think, for people who are excellent students, like Lenny and I were both like, we did really well in college, like just to say it, like we're smart. Everybody who gets into med school is smart. We're used to, as people who are used to getting straight A's or B's every now and then, we're used to like zeroing in on a correct answer like immediately and knowing like that's the right one. I think where a lot of the discomfort comes for a lot of students, and Eleni and I are just way too because we're perfectionists, is it's just really annoying when you cross out like three answers and you're like between two and you're like, man, where's my number one choice? And you like Eleni said, you do have to get confident in kind of reasoning through each answer choice and more of a process of elimination, which is also a good test taking strategy. If you can narrow your choices from five to two, you put yourself in a lot better spot. But I agree. I think it was uncomfortable at times, to say the least.
Yeah. And I hate to say it, but sometimes you just go by gut feel, right? You're between two answers and you're like, God, there's pros and cons to both of them, but my gut says this one. I don't know why my gut says this one, but it says this one. And when you're practicing, you can kind of go back through your textbook first aid, and say, okay, why did that gut feeling feel right? And usually there's a reason behind it. You learn it in preclinicals or whatever. But sometimes when you're on the actual test, you're just like, gut, I hope you save me.
Yeah, exactly. I think one of the other shocks of step one to me is I think both in my prep during the MBME exams and then um also doing UWorld was I think the real exam was specifically with ethics was really vague and it was just really uncomfortable. And like I felt well doing the test. It wasn't like even the MCAT, which I did really well on, where I'm like, man, like I like I was thinking about questions I got wrong. Like I felt confident throughout the exam, but it was an uncomfortable experience, like just with how vague sort of the questions could be and really like pushing you to that brink.
Yeah, I kind of want to. We've thrown around a lot of words, and I kind of want to talk about how we prepped, but just to make sure people know, UWorld is a question bank that you can buy. It is pricey, but I think it was really worth it. It was probably the question bank that was closest to the actual exam and really forced you to see topics that you just have never seen before. First aid is a textbook. I have my copy here. This is the Bible of step one. Um, mine's been loved, marked up, highlighted. My blur's coming in and out, but this is what I use. This is my primary text, and then I also use some other third person resources as well. Third party, excuse me, not third person, that we can kind of go through. But yeah, Noah, do you want to kind of walk us through how you prepped?
Yeah, so I think nowadays, sort of like the consensus, let's kind of start with time. I think both Eleni and I took a similar amount of time. We took our exams about a week apart. I personally had like about 6 weeks of prep. So with my med school, we finished up all of our preclinical courses in like mid-December, 2 weeks for Christmas. I was sort of studying then, and then really more of truly like a 4 weeks dedicated. Um, During that time, trying my best to get through, at least one or two blocks of UWorld. If you're a passive learner, I use Boards and Beyond throughout my prep. I thought that was really good. Um, Not a bad idea. Sketchy is a resource that we've mentioned on the podcast before, which kind of gives you picturesque mnemonics. So they'll show you a picture and tie those symbols to certain things that you have to know. Um, and that can be like high for chromosome 5 for say like Kruger syndrome, and sort of have those memory anchors. So a lot of people I know, I didn't necessarily have the time to go through it again, but a lot of people that I know, and I think Eleni did this as well, went through Sketchy again for microbiology, because actually one of the highest yield symptoms, like I can't systems, excuse me, I can't tell you enough how microbiology saved my butt probably by knowing that inside and out. So that was just kind of how I approached, probably about 5 or 6 hours a day, I would say, for about 4 to 6 weeks. And started incorporating the MBME exams, which are made by the people who write the test, um, sort of like about 4 weeks out.
Yeah, so I actually thank you for bringing up Sketchy. I actually watched all of Sketchy Micro and Farm prior to starting my dedicated. So actually I divvied it up like one or two a day starting in August of my M2 year, and I watched them all. And so I didn't feel like I had time to re-watch them when I was actually dedicated. But what I did do was I took like maybe half an hour to 45 minutes every day and relabeled like all the sketchy images and like checked them. So I thought that was really helpful. I use Boards and Beyond pre-dedicated. I am not as big on the passive learning as I think you are, Noah. We were just talking about this actually before we started recording. So I did do Boards and Beyond, but I did it like pre-dedicated. I watched like in my hard sections like cardio and palm. But I try to watch it during, and I just dropped it in the last couple of weeks because I didn't feel I had the time. One thing I did do, and I'm glad I did do, was I rewatched all of Pathoma again. So I went through the entirety of Pathoma. Dr. Star, huge shout out to him. He's saved so many students single handedly. But really like Pathoma, especially chapters honestly 1 through 6. I know like the Holy Grail chapters are 1 through 3. I really struggle with blood cancers, and I had a lot of that on my exam. And I think that going through Pathoma again helped me a lot. So I went back through Pathoma, whole thing, and then I rewatched chapters 1 through 3 the couple days before my exam. And then I did all of UWorld. I don't know, Noah, if you finished UWorld. I did 100 UWorld questions a day. I had also about I think I had 7.5 weeks. I had a little bit longer of a period than you because I took it 1 week after you actually, so it makes sense. Um, but I did every single UWorld question. I did 100 UWorld questions a day. It was a lot. It was a lot. It was a lot to do. And then I would review everything I got incorrect in first aid. I would make like study guides from that day. I would do Anki on like the ones that I got incorrect. And then I also had a strategy to like encourage retention. So I would review all today's wrongs, then I'd review yesterday's wrongs or like high yields, and then I'd review 3 days ago. And then so it was kind of like to try and like keep up that retention. And then when I finished UWorld, kind of had a couple weeks left, I went back through and redid all my UWorld and corrects and then like looked at the corresponding like notes I had from first aid. So I had a really rough kind of system. I was studying like 10, 14 hours a day, but it worked for me. Yeah, how much of UWorld did you get through, Noah?
Yeah, probably by the end I gone through about 40% of it. So like an okay amount, but certainly not as high as you'll see on Reddit. Am I percent correct? I don't know if you're comfortable sharing it, but mine was like 66, 67% ish by the time I had gotten through 40% of UWorld. I wasn't nearly as much of a beast as Eleni. Like after like 50 questions. I I just kind of lost track and being able to like meaningfully review. Of course, she was studying for longer each day, so that makes sense. But I think for me, I had a really hard time like keeping up with like 40% of questions wrong consistently actually adds up. So it was a lot of incorrects to review. So for me, it was like really first aid. Like I said, did my best to learn from those questions I did and really made sure to, if I did 40 questions a day, I'm really going to review those things that I got wrong. Why did I get it wrong? And how can I improve from there? Then also, like Eleni said, Pathoma was also a godsend, another great resource to bring up. I only did chapters 1 through 3. I went through it twice just because those first 3 chapters of your basics of pathology, um, and cancer and neoplasia are always going to come up on every exam. That never changes. So definitely super high yield. One of the things that I did, I used Anki in the beginning of my prep, especially for things like microbio and stuff, but I eventually dropped it because it was just becoming too much. But it was a great tool when I did use it. I was just like, am I really gonna dedicate, 2 hours to doing like 600 or 700 cards? And I think it was just I didn't have the bandwidth for it, but that's just me personally. One thing in the last 2 weeks that I did was Dirty Medicine, which is a free resource on YouTube. I think he makes really great videos on a lot of hard topics. So if you need something to just really have like those memory anchors and like some of his mnemonics are really good going into test day, I think is really helpful. And again, completely free on YouTube. And I thought that was a great way to review as well, especially like things that are maybe lower yield, but still sort of like kind of frequently tested enough to make it worth your time to go over.
Yeah, I love everything you said, like 100% agree. But I think you brought up two really important things. First of all, UWorld percentage. My first pass through UWorld, so this is pre-dedicated, I had 45% correct. And that really didn't make me feel very good about myself. And so I went on Reddit and I was like, hey, this was pre-dedicated. And someone responded and said, I don't know what you've been learning in med school, but clearly you've not been learning medicine. You're not qualified to be a doctor. And that really, obviously I kind of put myself out there, and some people may say I shouldn't have, but I'm first gen in medicine. I have to go to that those type of places to get advice because I don't always have that. And I think that, like, standing in hindsight, I reset my entire question bank and read it all every question, and I ended up, I think at the end of my first pass, I had about 60, I think it was 67% correct. And then by the time I finished all my incorrects again, I was up to about 75% correct. Um, I think that not fixating on the UWorld percentage is something that's really important. And clearly, that person that responded to me was fixating on my UWorld percentage, right? They didn't read anything else about me. And I think that a lot of people, they're like, oh, I got 30% on this section, I'm a failure. Well, if you're only doing 10 questions on maybe a section that you're a little bit weak on, that's not really unexpected, right? And so it's about not really about what your percentage is, it's about what you're taking away from what you get wrong. And I think that's something that we learned as we grew and evolved through those 6 weeks. The second thing that I thought that was really important that you brought up was about dropping things. And I think that it's not said enough because everybody's saying that they're using all these different resources. I use this, I use that, I can't believe you're using this. I think that there's a lot of guilt that kind of follows. It's like, oh, maybe I'm not doing enough Anki, or maybe I should be watching Pixarize or whatever. I tried using Pixarize because a lot of people, including Noah, suggested it. I watched it for maybe a couple 3 weeks. I realized I was retaining nothing was being retained, and I was like, this is a waste of my time, so I stopped watching it, right? And so you have to kind of figure out what works for you. My study schedule changed 3 times during my, like, I reprinted the whole thing, type of full-blown change. I started originally wanting to do it systems based. I changed it, so I was doing 60 questions system based and 40 questions random, to kind of like incorporate both into what I was doing. So, like, be willing to change and also recognize that, like, you have a certain bandwidth. And if your bandwidth is being, exceeded by some resource or whatever that you think you have to use, drop it, because you're going to end up burning out and you're not going to retain uh, anything that you're studying. And then what's the point of sitting there for 14 hours a day if you're not retaining?
Yeah. I again like ditto to everything that you just said. I'll talk about the world percentages again because I think you can't really ever lose sight of this. UWorld is a learning tool. It depends on how you're using it. Like if you're using UWorld closer to the end of your prep, yeah, your score should probably be a little higher. But if you're starting out dedicated or you're using it throughout clerkships, your percentage is going to be lower, and that's expected. Use it as a learning tool and pay attention to why you got certain things wrong. If you're always getting like questions on dysmenorrhea wrong, you need to go back and remove and review like what are the causes of dysmenorrhea and like go through that and understand that a little better. Like for me, like that was a weaker topic because we only had 2 weeks of OB-GYN and urology for preclinical. So it wasn't really a lot of time to digest all the things that can go wrong. So that was a little bit of a weaker area. And it's important to learn for clerkships too. Like Eleni and I are just starting clerkships. I've been in clerkships for 2 weeks. Your world percentage will be trash. I almost guarantee it'll be trash. And like right now I'm hovering at like a solid like 55%. And like you just got to give yourself grace. Like it's truly okay. It doesn't mean I suck. It doesn't mean I'm not going to be a good doctor. It just means that I have areas I need to improve on like everybody else does. Um, and then I can second dropping things as well. And notice how Eleni and I were different. I dropped Anki, she dropped like boards and beyond, two very different ways of learning material. And that just goes to like the style of learner. So don't feel guilty if, everybody loves Anki, everybody loves Sketchy, everybody loves first aid. If one or all three of those sources aren't for you, that's perfectly fine. And don't let your friends at med school or anybody, or certainly somebody on Reddit tell you otherwise. Um, I think time, because one of the things that you might have noticed is like Eleni and I had different amounts of time that we studied every day. I was probably about 5 or 6 hours. She was saying like 10, 12, maybe even 14. Um, that's going to vary between people. It doesn't mean you're smarter or more efficient. I might have been less efficient in those 5 or 6 hours than Eleni was in 2 days, but it was just we had different bandwidths, and that's perfectly fine. And that's been Eleni's way of studying for as long as I've known her. And I've been this way as long as I've known myself. So it's just it's just one of those things, and it's okay. Everybody has different learning styles. Everybody has a different way of learning the material and how much time they need to learn that material. And it doesn't say anything about your ability to be a good physician.
We kind of skirted around it a little bit. Do we want to talk a little bit about burnout? Because I definitely went through, like, it was about halfway through for me. I was at a point where if even looking at first aid made me want to get sick. Like I was so burned out.
Yeah, let's talk about burnout. Because I mean, let's look first of all, what's just not expected of you and the stakes. So you go through preclinical, you have to, even if you're at a pass fail institution, it's still a lot of pressure to make it through each of those classes and to not have one class be the one where you mess up. Like I remember like our last course was maybe like um our last organ system was GI. And GI isn't like the most it's certainly not like renal or something. But like I was just like, man, I felt more pressure about that because it was the last organ system and I didn't want to mess up. And then you go straight from preclinical into dedicated, like both of us went straight into dedicated. All the while we're like seeing patients in clinic, we're trying to do research, maybe some volunteering like that we're trying to do on the side. Then you're doing like Eleni's doing 100 UWorld questions a day. I'm like doing UWorld and boards and beyond. Like it's a lot. Probably like especially that last week. Like and I would say like about halfway through too. Like by week 3 in my 6 week prep, I was over it. I was like, I want this test done. I'm like, I know I shouldn't, but I really want to push my date up and get it over with. Um, so I think throughout the process, you got to give yourself time to recharge. And that's really important, even if you feel like you're behind. For me, that was going to jujitsu every day. And I made that, I'm like, I can structure my day in a way that I can have time for my self-care. And it's important that I move and get exercise. Maybe for somebody else, that's reading a book or meditating or watching a good movie with their partner. So you got to make time for those things and you can't feel guilty about it because even if you do those self-care things, it's going to get hard and you are going to burn out, but you got to learn now. You got to learn now before you get to clinicals, like how to manage burnout.
Yeah, I also try to exercise every weekday. Did it happen every day? Not always, because our school also had a consolidation course, and sometimes that would take up a lot of time. But I really made an effort to get exercise, and also spend time with family. For me, I think isolation is a huge killer. I had some friends that really began to struggle with their mental health, kind of because they were isolating themselves. So just like don't do that. But I burned out pretty hard about halfway through, about 3.5, 4 weeks in. And so I actually took a full weekend off. Like no UWorld, no MBME, like no nothing. Like just 2 days. I pushed my schedule back. I redid it because I really needed that. And I think that actually helped me come back stronger. And then kind of towards the end, I like started tapering my schedule off. Um, and then by the last day, I was doing really like the day before I like reviewed stuff, but it was like just going through stuff I found hard and just watching a lot of Dirty Medicine, which Noah already mentioned. Huge props to Dirty Medicine. I watched their Murmurs video the day before my exam, and they saved my life. So um, shout out to Dirty Medicine.
Shout out to Dirty One. Yeah. Yeah. I agree with all that. So we've one of the things that we've sort of talked about and throughout our prep is the use of the MBME exams. So maybe we can start with you, Eleni. Like how did you incorporate it into your prep? How did you use the estimated chance of scoring as a way to guideline? Did you pay attention to it? Did you not? Did it worry you? And sort of like, because I feel like a lot of students have questions because now instead of getting a 3-digit numeric score, the MBME practice exams actually tell you you have a 70% chance of passing, 99% chance, all the way up to 99. You can't get to 100. So I'm going to stop people right there and be like, you can't get to 100. But, how sort of was that experience? Was it a roller coaster? Was it encouraging seeing your scores go up? What was the deal with the MBA exams?
So my school actually gave us vouchers for two NBME exams, so that kind of threw off my schedule a little bit because we had to take them on certain days. Um, but typically what I did, so I started with one as like a baseline, and I did not do very well on that first one. I don't think anybody does, unless you're a genius and good for you. But it I didn't do super well on the first one, and I think that was like great motivator for me to like work really hard. And then I kind of worked over 2 weeks and then took another one to kind of see where I was. And my scores jumped into passing within those 2 weeks. And people were like, what did you do? What did you do? I really focused on my weak areas. And one thing that I found about step one that is different than studying for your Oregon block exams is that step one is integrated. And that is why I had 45% correct on New World pre-dedicated because I didn't learn everything. And even by not having learned the neuropsych block, I was getting so many questions wrong because even if it is under cardiovascular, if you don't understand all the other systems, you're not going to get that question right. And I think that was kind of a big factor is like stepping back in those 2 weeks and thinking about the integration. I took so of the new NBMEs, so 25 to 31, I took every single one except 28. It's just kind of the way the chips fell. And they told me not to take that one in case you fail. You have another one to like assess. And thank God I didn't fail the exam, but that's always something to consider. I think they were very nerve wracking in the beginning. I was really anxious taking those, especially when I wasn't sure if I was going to be consistently within passing. But by the time I took NBME 31, I was like taking it on my couch, like after I'd eaten dinner. Like I wasn't stressed about it. And like, I'd had a drink or whatever, and I still like passed. So I think like as you kind of like you learn to use it as a tool rather than something to like freak you out. Um, But yeah, I think the 99% chance of passing, it doesn't feel like it means much. But I read on Reddit, so if this is wrong, don't sue me. But it's like if they ran like a hypothetical, like the computer runs a hypothetical amount of simulations in the background based off of how you're answering, like your scoring pattern. And it was something to the effect of it's like if it's 40,000 simulations of those, like you would pass 3,999 of like sittings of step one. So it's essentially the computer's running simulations in the background of you taking a bunch of different hypothetical step one exams. So I think that understanding also helps like put it into perspective. Noah, how about you?
Yeah, I agree. I took MME exams. Let me see. I took everyone except for 25 and 26. I think I took four. I took 27, 29, 30, and 31. Those were the four that I took. So I only took four of the possible, I think, six or seven. Um, Again, like your first one, you don't start out great. I'll just be transparent. Like not that you weren't. I started out at like 59% correct, and then
I
like
was about there. Yeah.
yeah, and then the next 2 weeks, I went like the next time I took one was like 65, then like 66, then I jumped up finally to like 68, and then like by the time that another new term that we're gonna throw at you guys is the free 120. They just updated it
Oh,
again
I
this
forgot
year.
about that.
So it messed up sort of our nomenclature because it used to be called old free 120 and new free 120. So now you have like the old, the new, and the new free 120, I guess is what they're calling it. Um, but basically what the free 120 is, and by the time I got there, I was like getting like 80% on those. And I think Eleni was the same way, certainly high 70s, like low 80s. Um, the free 120 is basically 120 questions that the MBME provides for free, and it's probably the most accurate representation, not in terms of content, I would say. I think that's probably MBME 31, but sort of like in terms of the length and like and the certainly the length of the question stems I felt was the most accurate was the free 120. Um, the other thing that I want to mention is the MME has years and years of data backing up these predictions that they run. So you can really have confidence that if you're like 90% or above, and different schools have different guidelines before they let you sit for the exam. I've heard some schools on Reddit, they want you to be like 98% chance of passing before they let you sit for an exam. My school didn't have any requirement. They just recommended that you be above the 90% chance of passing. I think Eleni had a sort of score cutoff for what they recommended. But again, use them as a tool. They're 200 question bank. They're 200 questions at a time. They're meant to simulate the real exam from the interface and everything. And I would treat it just like MCAT. It was better than MCAT prep actually in my mind because I wasn't dedicating 8 hours to sit and take a practice exam. The MCAT was ridiculous. Not that this wasn't ridiculous, but at least it felt more manageable. At least the practice exams did. Than MCAT prep. I hated MCAT prep with a burning passion. I'm so thankful I never have to do that again. But yeah, that would be my spiel on the MMEs. I don't know if you have something else to add about that or the free 120s.
I forgot about the free 120. They updated it, I think, 4 days before, 3 or 4 days before my exam. And I like my actual exam. And I was so upset because I had taken free 120 at my testing center. Um, yeah, honestly, this was much better to study for than the MCAT. Like, yeah, I definitely had like sad girl days where like I really wasn't feeling too hot about myself, but like it was nothing like studying for the MCAT. And in part, I think because the content's more interesting. So for those who are kind of worried about that, fear not, it doesn't feel like the MCAT. But yeah, I think you covered it pretty well for the MBME. It's just like take them seriously, and I think one big thing that like I wish that they emphasize more to like incoming first year classes, especially in pass fail schools, is like you really need to try during like your didactics, like your not didactics, preclinicals, um, because I think that if you studied a lot and you had a strong foundation already coming in, if you didn't just study for the 70%, but studied as hard as you could, um, I think that there was a difference. Um, and, you know, some people had to postpone their exams, right, and kind of talking to them, and they shared with me that they felt it was because they really had applied themselves in some ways during their preclinical years. So like make sure you take your preclinical seriously, and not everything that you learn in preclinical is going to be relevant to step one, right? That's just the reality of it. But recognizing its importance will lay that foundation for you.
I agree. I think there's nothing better you can do for yourself going forward in med school, especially if you're just hearing this as somebody who's starting M1 pretty soon, like this coming summer. Take preclinicals, like Eleni said, seriously. Treat step one as if it's not pass fail, as if it's still scored. It serves as the foundation that sets you up to learn more of like step two and step three are more clinical. And step one is actually fairly clinical, but step two and three even more so. And they're testing you more on like they're presuming you know how to diagnose. Now they're asking you how to treat. So if you can't reach that first step, you're going to really struggle with if you don't know what you're dealing with, how do you know how to treat it? So I think it's really important to take it seriously. And it's helped me on the wards. I can't tell you like, and I know step one wasn't that long ago for me, but starting family medicine, it's been extremely helpful having that good foundation, not being like, oh, what's a calcium channel blocker again? Like you sort of have that first step. So now I don't know what dose you prescribe it at, or maybe for how long or what have you for different medications. But I at least nobody has to sit down and explain to me, what a calcium channel blocker, and that can be helpful. You can maybe even impress your attendings for some of the zebras that you might see on the wards, and they'll be like, "Oh man, that medical student's on their game." So I would take it seriously.
Zollinger elephant syndrome. Um, well, I think this is one of our longer episodes, so I think we can kind of move towards wrapping it up. But I don't think this is something to be afraid of. It's a rite of passage, and that's what one of our advisors said to us, that it's a rite of passage. Everybody does it, right? And how you choose to do it will set you up for success later, or it can set you up for failure. And I don't say that to be scary or mean, but I say it because I want to impress upon people the importance of taking this exam seriously. Um, because I think there's a lot of folks who regret not not doing that. So yeah, I think the advice is study hard, take it seriously, but continue to take time for yourself, because you are going to have to learn how to manage and stay sane throughout not just your rotations, but through the rest of your life, and as a physician. Anything else to add, Noah?
No, I would just say, study hard, take care of yourself, like Eleni said. You'll read, I kind of want to leave you guys with some pearls of high yield. Everything is high yield. So don't fall into the trap of like this isn't high yield because I bet you'll see it on your exam. But I would focus, make sure you don't forget about your biostats, don't forget about your ethics. Um, Listen to murmurs. There is audio and visual on the exam. Know the basics of your imaging, and know the most common pathologies and have a sort of idea of what you're treating and why you're treating. So I think that's sort of a good place to go, and you can use all the resources that we talked about to help you get there. But it's doable. It was better than the MCAT. I'll say it again. It was way 10 times better than the MCAT for me. Um, and yeah, I think, like Lenny said, it's a rite of passage. It's a gateway to being in the clinic, to a stepping stone to becoming a doctor and ending that next phase of your training. And the fun is just beginning. So it's a good time.
All right. Well, we believe in you guys. Thank you so much for spending, gosh, I don't know, half an hour, 40 minutes. I don't know how long this has been. I'll find out later. Um, uh, your time with us today. As always, if you enjoy our content, please make sure to like, subscribe, follow us on Spotify, Apple Podcasts, or wherever you listen to podcasts. Follow us on YouTube. And yeah, we really appreciate your time. So feel free to reach out with any questions.
Yeah, good to see you guys. We'll be back in another couple of months and maybe talk about clinic and how clinical rotations are going.
we'll be back, preferably before I start surgery.
Preference, yeah, that's a good goal. How about we set that? We'll
Yes.
set 8 weeks for our next episode, and we'll get it. We'll get Eleni before we won't ever see her again in surgery as she disappears. So, all right,
All
guys.
right, guys, take care.